Welcome. Am I still on? Okay. Welcome to today's webinar presented by SAMHSA Gaines Center with the support of SAMHSA, which is the Substance Abuse and Mental Health Services Administration. Today's webinar is part 2 of our virtual learning community on early diversion and is titled Addressing the Critical Need for Housing and Strategies to Overcome Barriers to Improve Housing Access. The two presenters today are Julia Orlando and Leticia Robinson, and I will introduce them shortly. I am Michelle Saunders and will be your moderator for this webinar. I am a consultant with Policy Research Associates and have an extensive background in working in both the private and public sector around behavioral health and criminal justice issues. Before we start our presentation, I have some housekeeping items to review. The views, opinions, and content expressed in this presentation and discussed do not necessarily reflect the views, opinions, or policies of the Center for Mental Health Services, the Center for Substance Abuse Treatment, the Substance Abuse and Mental Health Services Administration, or the U.S. Department of Health and Human Services. If you have any questions for the presenters or regarding the technology, please type them in the Q&A pod on the right of your screen. We will address as many of your questions to the presenters today as time will permit. We will also make sure you have their contact information so that you can reach out to them at a later time if your question was not answered. We will also be conducting a poll and appreciate your participation. When you see the poll pop up on your screen, please enter your responses. This poll will give us an idea of who our participants are for this webinar. This webinar is being recorded and slides will be disseminated via the Gaines listserv following the webinar. We will also notify you when the webinar recording is posted to SAMHSA, to the SAMHSA's YouTube channel. A certificate of attendance will be available for download at the end of the webinar. Please note this certificate is for personal portfolio use only and is not for continuing education credits. We have arranged for American Sign Language interpretation for this event. The interpreters today are Dave Gratzer and Maureen Moose. To view American Sign Language interpretation, go to Layout in the upper right-hand corner of your screen. Then select Side by Side for best visibility of the interpreters. There's live captioning for this event. To view live captioning, select the Accept button in the multimedia pod, also located in the lower right-hand corner of your WebEx screen. The color contrast of the live caption pod can be changed as needed, and the high contrast style is recommended for best visibility. And next, I would like to introduce today's, I apologize. Right now, I'd like to introduce the upcoming virtual learning community series. We have our webinar on housing, but we also have 3 more virtual learning community series in May, June, and July, and we encourage you to sign up for those as well. So today, I'd like to introduce our agenda. And as I indicated, I will be the moderator and provide the opening and closing for today's event. But in between, you'll hear presentations from both Julia Orlando and Leticia Robinson. And now I'd like to introduce our 2 speakers for today's presentation. First, we have Julia Orlando. who is director of the nationally recognized Bergen County Housing, Health, and Human Services Center in New Jersey. She led Bergen County to end veterans homelessness, as well as become the first community nationally to successfully reach functional zero in chronic homelessness. Ms. Orlando serves on the executive board for New Jersey's largest hospital, the Bergen New Bridge Medical Center. And previously, she has spent 20 years working in supportive housing in New York City, developing specialized housing and providing mental health training for 1,000 New York State parole officers. Next, we're also joined by Leticia Robinson. Ms. Robinson is the Assistant Director for the Office of Supported Housing for the Georgia Department of Behavioral Health and Developmental Disabilities. She has maintained multiple leadership roles in the Georgia Housing Voucher Program and community residential and crisis homes for those with serious and persistent mental illness. Currently, Ms. Robinson is the state PATH contact for homeless outreach under SAMHSA, and PATH stands for the Project for Assistance and Transition from Homelessness. Ms. Robinson has over 20 years of experience working with the continuum of care and spearheading projects that serve the most vulnerable populations, including those in chronic homelessness with co-occurring disorders, women and families, prison reentry, and persons living with HIV. Now that we've met our presenters, here are some observations about who is participating in today's webinar. So many of the attendees are from primary urban. We have about 47% of our attendees come from an urban community, with 23% from suburban and 24% from rural. In terms of representation of professional affiliations, we have 2% from law enforcement, 4% from judiciary, 4% from policy-oriented organizations, 3% from corrections, 4% from probation parole, 2% from academic research, 8% from crisis service providers, 2% from hospitals, 9% from community-based hospitals. We have 3% from public health, 13% from government. The bulk of our attendees today, 37% from community-based providers, and another 15% recognizing another form of professional affiliation. So we really want to thank everybody for joining in, and I think we have a great mix of participants, and we'll gain a lot from what our presenters have to offer for today. So now I'd like to turn this over to Julia Orlando to begin the presentation. Welcome, Julia. I think you're on mute.
I am. Thank you so much, Michelle. I wanted to thank you and everyone at Policy Research Associates and Gaines for having me today as a speaker. I also want to welcome everyone. This is quite a prestigious group of people that are joining us today, and hopefully we'll be able to share some vital information on this important work. I'm not able, oh, I see, okay. There we go.
You may have to scroll
in the wrong
down.
direction. I'm going in the wrong direction. All right, here we go.
There we go.
Okay. So I have a lot of slides today, so I'm going to try to go through them at a relatively good clip. And certainly if there's additional questions, people can ask me in the chat and as in the discussion piece. But I just want to do a brief overview just as homelessness as a public crisis. And for all of us, certainly there's a lot of this in the news, especially in response to COVID-19. We certainly have seen many crises within homelessness, and also anticipate upwards of a 45% increase in homelessness once the moratorium ends and people begin to become evicted into our communities. But we know that homelessness is now recognized as a public health crisis and that it's highly correlated with behavioral health conditions, and that solutions to homelessness become complicated because of issues around poverty. In many places, there is housing affordability, structural racism. There's been a great deal of conversation around that just this week, especially on the West Coast, and also behavioral health conditions. Mental illness and substance use disorders are consistently associated with housing instability. Numerous studies have demonstrated that behavioral health conditions are a significant risk factor for people to experience homelessness, as well as also being a barrier to exiting homelessness. I want to move through this. We know that persons experiencing homelessness face significant barriers to other positive social determinants of health, right? So we know that that can precipitate or exacerbate these psychiatric or substance use conditions, especially a lack of food, a lack of money, unemployment, health insurance, clothing, all of these things. Having access to all of those things compromises the person's ability to protect themselves from infectious disease or manage their behavioral health. So for those of you, I know there's 37% that are community-based on this call, you know that the natural supports that people have had in their community no longer exist due to COVID-19. So even the most basic of services that people were able to have access to really were severely compromised during this pandemic. And we know that mental illness and substance use disorders coexist in a significant portion to those experiencing homelessness. And the prevalence of abuse and trauma, not just for unsheltered, but also sheltered homeless individuals, is significant, especially for those people who have co-occurring mental illness and substance use disorders. And we also know that some contributing factors are the limited options that we have for people to help stabilize someone in crisis. So we know that shelters are a very important function, but many communities, I know there's a good number of people on the call from rural communities, shelter may not always be an option, or shelter might be very far away option. Even when there are shelters, they might be at capacity. And certainly during COVID, it's been very difficult to safely operate any kind of congregate shelter at this time. So this scarcity of decent, safe, and affordable housing contributes to an increase in unsheltered homelessness in many communities, especially in light of this pandemic. And law enforcement agencies are training officers on the cause and impacts of homelessness, especially if you see our CIT program, which especially helps officers address persons with mental illness and other disabilities. However, we're not operating this on a large enough scale to meet the scope of the problem, and it may not incorporate the most effective solutions to homelessness, which we know are quickly connecting people to permanent housing and services. I just want to give you a little overview of Bergen County, New Jersey, and kind of where we are and a little bit about our demographic. So we're the most populated county in New Jersey. We're located right outside of New York City. You can see that our population is just under 1 million people. Our median household is around just under 100,000. We are predominantly a white county, just under 20% Hispanic Latino and 7.1% African American, 63% home ownership. You can see our median property value is just under 500,000 and our median gross rent. So this is a affluent area. It is very difficult for people to find housing that they can afford, especially if they are on Social Security or they have limited income. So Bergen County, our continuum of care is 33 agencies strong. The COC was part of this 10-year plan to end chronic homelessness. And during this time, we analyzed our system shortfalls and our barriers. And what we did was we reorganized and recreated a crisis response system to homelessness. So the goals in our 10-year plan, which was finalized in 2008, so the sunset was 2018, was to restructure our county funding, to construct and design the facility that I am now the director for, the Bergen County Housing, Health, and Human Services Center. The concept of this was to have a one-stop location and a single point of entry. And having a housing first foundation and having housing first projects through our COC partners, including our Housing Authority of Bergen County and Advanced Housing. And also having rapid rehousing programs, including some of these other agencies that are our partner agencies. Developing a coordinated assessment system, and of course, most importantly, developing a permanent housing stock so that we would be able to move people into permanent housing. So our transformation process, there was and this is very important, there was political will and there was a leadership commitment to ending homelessness. There was integration of the COC with this 10-year plan, meaning that all these partner agencies had input. We had agency engagement in every part of the process, restructuring of local funding to support this new system, and technical assistance and support to make sure that we had program excellence. So we did realize this transformation. We did that through intensive case conferencing for individual cases, through system funding that's reviewed holistically to support our change, to this community-wide commitment to successfully housing everyone. You know, before we opened up our facility, the Bergen County Housing, Health, and Human Services Center, 200 stakeholders were interviewed and had input into this process, so that when we launched this revised, new and improved housing homelessness response system, those 200 stakeholders were part of the process when we reopened. And we reminded people of the commitment they made to us when we were doing those stakeholder outreach interviews. We have the Public Housing Authority and their support for ending homelessness. And then, of course, engagement of new partners, which is very important because as you go along, you'll have new crises in your environment. Like right now, we have a pandemic. So we have different partners in our midst that we did not have 10 years ago. And it's important to consistently be adding that. So this is a photo actually of our beautiful facility. Many people say it looks like La Quinta Inn, which was a really funny thing to say 11 years ago. But now that we realize that buying up motels and converting them into housing is a pretty good idea. And so I kind of love that now that, yes, we looked like a very nice motel. It is a shared project between the County of Bergen and the Housing Authority of Bergen County. The mission of this center is to end homelessness by providing a full continuum of housing services, including prevention, temporary shelter, and permanent placement. So we have been open since 2009, and this was a key feature in our 10-year plan to end homelessness. And it really serves as the foundation of a concentrated community-wide effort to find permanent housing for people who are experiencing homelessness. And what you can't see in the photo that's very relevant to our conversation today is it's directly across the street from our Bergen County Jail, which has a capacity of 1,000 inmates. So our design was also to prioritize individuals that were incarcerated and upon release would be experiencing homelessness. So we are very connected to our jail, which is located right across the street. A little bit about the facility. It's a 90-bed shelter. It's open 24 hours. It's a one-stop design with a drop-in program 365 days of the year, even on Sunday, even on Christmas. We're always open. We have a nutritional program. We provide 3 meals a day. We do about 80,000 meals a year out of this one facility. And 2 of those meals are open to the community. And that's really important because even if a person is housed and getting meals, and we're seeing them on a regular basis, we can kind of assess them, see if there's changes, and maybe intervene before that person becomes evicted or loses their housing. We have showers, laundry services, storage, mail, computer, telephones. I just want to go back to the storage piece, because if you're not going to allow people to bring belongings into your shelter, they're not going to come into your shelter. So that's a very important thing that we do provide in our facility. And we do have wellness services, including a full-time nurse that is available on site. So the design of this facility was to be a command center, to have flexible office spaces for collaborative partners. So think about it as the county owning a shelter, but not staffing it. They did contracts with our partner agencies in the community who came on site to perform the work that they are most expert at. So we were not replacing what other people were doing in the community. What we were doing is providing a location for everyone to work together with a population that would be there and would be accessible to them. They wouldn't have to be out in the community looking for them. They would be there with us because either they were in shelter, or they were getting a meal, or they were getting a service, or they were getting a shower. And it's a very effective model for not replacing your services, but co-locating them. So some best practices of a low barrier housing focused shelter. First and foremost, it's housing first, which really means that in our facility, if you're in need of shelter, we're not requiring sobriety. We're not requiring that you are on psychiatric medication to come into shelter. The focus really is, if you need shelter and you're unsheltered and you're on the street, we're going to make it as easy as possible for you to come in. It also has rapid access to permanent housing, and that's really important. This is not about having people come into shelter for months, years. This is about bringing people in and quickly connecting them to housing. It's very data driven. We have a persistent coordinated outreach to people, including working with our 70 municipalities and police departments, 70 different police departments within our county. We engage and support our public housing authority. And my role especially is to set and hold partners accountable, to making sure that everybody's doing their piece in this work to make sure that we're getting people to permanent housing. So just a little bit about housing first, right? Housing first approach includes key components to ensure people that are homeless and have mental illness and substance use disorders and criminal justice involvement are quickly connected to housing, right? With very few barriers. Basically, the idea here is that persons who are justice impacted, who do not have access to permanent housing, will often cycle between jails and shelters and hospitals. And we know that Housing First is a proven model in reducing homelessness and has been applied nationally. And we know that using this, we were able to reduce veteran homelessness by 50% over from 2009 to 2019. A little bit about different Housing First housing models. You have permanent supportive housing, right, which pairs long-term rental assistance with supportive services. We used this model predominantly in our efforts to end chronic homelessness. And many of these were scatter site shelter plus care vouchers, or COC vouchers. It's really targeted to individuals and families with chronic illnesses, disabilities, mental health issues, or substance use disorders who have experienced long-term or repeated homelessness. We also have rapid rehousing, which is an intervention for individuals and families that don't need that long-term intensive ongoing supports to quickly exit homelessness, right? These services are usually for people that are employable or income sustainable, but the assistance is offered without preconditions as well. Looking at HUD funded housing, right? You've got your housing choice voucher program. That's what people call Section 8. We did use this kind of housing in our work. And even for some people, we paired it with services in the community that were appropriate for that individual. This has become the dominant form of federal housing assistance. The program provides voucher to low-income households to help them pay for housing in the private market. And we know that this has been found to sharply reduce homelessness. We also have public housing, which is federally funded housing, where the rent is at a subsidized rate, right, where the person's paying 30% of their income. And this is eligible for low-income families, the elderly, and persons with disabilities. So we know that both public housing and housing vouchers are proven to end homelessness. And only 1 in 4 households that are eligible for such assistance receive it due to a lack of funding. But I can tell you that I wholeheartedly believe that our new Secretary of HUD will change this. I believe in my heart, and from what I read, that she is committed to making this more available to more people in our country. And then a little bit more about our continuum of care, HUD funded housing. You know, we know that the demand for these limited housing resources exceeds the capacity of each community. So our community COCs use a process known as coordinated entry. And there's a lot of discussion around this and what's the right way to do this. And basically, the most important thing to understand about this is that in order to help people in your community, you have to know who they are. So coordinated entry is really about, you know, having a by name list, knowing who's homeless in your community, matching people who need the most service enriched programs to those programs, and also helping everyone else on that list, not just the people at the top of that list. And it's also important that you have access points in your community where people can come into your system to get that kind of assistance. So we do use a housing prioritization questionnaire. What we do is we make sure that this is available to everyone in our community. Anyone can fill this out and send it to us to get a person on our housing prioritization list. We also use a vulnerability index service prioritization decision assistance tool. It's a big mouthful, which is affectionately known as the VI SPDAT. But we don't just use that. We use that in combination with case conferencing. So let's say a person responds and they say, I don't need help, I don't have any of this, but the caseworker, the case manager, the person working with them knows that they do. That also gets put into the conversation about matching for housing. And then you have the housing prioritization list, which is our by name list, which helps us identify clients in our COCs that are the most vulnerable. And I'll tell you that when this works well, what happens is your most vulnerable persons on the street should be on the top of this list and not left out because they're not able to advocate for themselves. This is really about making sure that we're getting services to the people that are most in need. So we have a very robust culture of collaboration, and it's our mission and our structure that we nurture a culture built in collaboration, learning, and shared services. And so what we try to do is we try to bring in all of these partners to work with us hand in hand, to work with individuals. And this may also include probation, parole, jail diversion, all of our mental health partners, our healthcare partners, and truly the list is quite expansive. The idea being that all of these different partner agencies contribute to the success of getting someone to permanent housing. So where to start? Sometimes people say, yeah, I know collaboration is good, but I really don't know, where do I start with that? And basically you want to collaborate and partner with key housing, homelessness assistance agencies and providers in your community. You want to know the staff at these key agencies who can help you navigate local coordinated entry systems for supportive housing and homelessness assistance. And yes, the expression is true, you know, it's who you know. Knowing who these people are, having a relationship with them will greatly open up those doors in this process. And these include your local continuum of care, you know, or your COCs, your public housing authorities, your state, county, city housing departments, and also your faith-based and neighborhood organizations as well. And some housing programs in the community might include transitional housing, supportive housing, rapid rehousing, affordable housing, and shared housing. So I just want to spend a moment to talk about the Housing Authority of Bergen County. I actually am employed by the Housing Authority of Bergen County. It's very unusual for a housing authority to be at the head of a shelter. You don't see that really anywhere. And within our COC leadership, our housing authority is part of that executive leadership. So this unique relationship between the housing authority and the County of Bergen is very innovative because our housing authority established a policy of a 20% set aside for housing vouchers and also set preference within its administrative plan for people experiencing homelessness. So this kind of commitment and dedication to ending homelessness through collaboration is really quite unique. And in my opinion, one of the strongest reasons we were able to be the first community in the nation to end chronic homelessness. The Housing Authority, I am the director, manages the Triple H Center. Again, it's a shared services project. And this is quite a unique environment because if you think about it, I'm managing the shelter, but I have direct access to housing opportunities. And so when you marry those two together, it's really a perfect combination to end homelessness within your community. We also have navigation, rehousing, and stabilization assistance. You know, everyone works from a centralized housing prioritization list. And I know that this sounds like we're all very disciplined, and sometimes we're not, and sometimes, you know, people will go off the rails, and it's my job to kind of bring them back and focus on this. But you know, your case management services are really a crucial part of this work because you can hand someone a subsidy, you know, a voucher, but getting them to that housing and keeping them in that housing, well, that takes case management and housing search and a lot of other work. So the case management services that we work with include ICM, integrated case management, transition services for our folks that have criminal justice involvement, Housing Works, which is based at our facility. We have our PATH team, which does outreach to the homeless mentally ill, Permanent Affordability Commitment Together, our PAC team. We also have our rapid rehousing case managers, our AOTS team, and we also have our services for veterans, which are our 4 SSVF agencies. We also have our stabilization resources. We have our mental health agencies, which also provide supportive housing. You can see the list there. And then in addition to that, we also do community engaged landlords. We work with them. We have long-term higher level of care facilities when that's appropriate for people that we can connect them to. And again, our veteran services. So our landlord partnerships, you know, this is really key to this work, you know, having a healthy and robust connection with landlords who could overlook background checks and poor credits. But collaboration is very helpful. Communication is key. You know, you're going to get your rent every month, no matter what. And you know what? If you have a problem in the unit, you're going to call me. Here's my cell phone. And I'm not going to abandon you once we place this person into your unit. And so these are some of the recommendations we have, you know, creating relationships with landlords, listening to their concerns, maybe beginning with cases that, you know, may be more successful initially, educating them about how housing improves our community safety, you know, making sure they can reach you when they have a question or a concern. If you can, create a risk mitigation fund to assist if there's any damages or problem behavior, and partnering with or creating expanded housing navigation to apply for rental assistance, apartment search, negotiate with landlords. And again, lastly, once the person's housed, always work quickly to intervene if challenges or problems arise with that individual. Our criminal justice partnerships are a priority. So this is a priority population by design. As I said, they're located right across the street. We do in-reach into the jail. We are connected to people before they're released whenever possible. We work very closely with jail diversion, drug court, probation, parole, ISP, AOT, whatever we need to do to really get that person the services that they need. we provide this kind of on-site services. And what I hear from our criminal justice partners is, it's so great because I don't have to make 5 appointments outside. I can do all of those appointments right in your facility. And they absolutely love that. And the chances of the person connecting successfully, of course, greatly increase. We also redirect people when they fail. You know, we don't just throw them out of the shelter. We're working with our partners to intervene prior to any kind of disciplinary action or possibly removal. And we also have a very strong commitment to CIT. I'm CIT trained, my whole staff is CIT trained, and part of that CIT training is they come and tour the shelter with us. And then lastly, I also do a quarterly meeting with all of our Hackensack collaborative partners, which include law enforcement, business, retail, and social service agencies, the library, and our hospital. And of course, you know, I just went over our benefits, and clearly having all of this accessible to them is really critical. Just very briefly, our outcomes in the past 10 years, we've housed right now, I think it's just under 2,000 people who are chronically homeless. Now, since we've ended homelessness, we're looking at about 20% of them were chronic, because we do not have chronic individuals in our communities really any longer. We do a lot of prevention. On our last point in time count, actually, I have the 2021 data since I did this slide. We had 8 unsheltered homeless on the streets in a community of 1 million people, which is, it tells you that even during a pandemic, this model is sustainable. And we have been sustaining functional zero for the past 3 years. Just lastly, looking at kind of what works for us, you can see these are all of the key areas that really let us know what's working. Just pointing out here, having set-asides for housing, having these robust monthly meetings and case conferencing, having this political will and a low barrier shelter, using diversion whenever possible, having this housing first platform, and having, most importantly, this government, nonprofit, and faith-based collaboration and engagement. And these are just some of my references, and I'm going to turn it back over to Michelle. Thank you.
Thank you, Julia. Really appreciate that. And now I'd like to turn this over to Leticia Robinson for her presentation.
Good afternoon, everyone. I'm so excited to be here to tell you a little bit about what we're doing in the state of Georgia. And I am going to advance the slides. Hopefully this will work for me. Yes. Great. My name is Leticia Robinson, and I serve as the Assistant State Director for the Office of Supportive Housing for the Georgia Department of Behavioral Health and Developmental Disabilities. That is a mouthful. DBHDD is what we fondly call our agency in our state. This is a quote that we live by. True public safety requires a collaboration between law enforcement and the community. Our vision and mission for the Department of Behavioral Health: easy access to high quality care that leads to a life of recovery and independence for the people we serve. Our mission: leading an accountable and effective continuum of care to support Georgians with behavioral health challenges and intellectual and developmental disabilities in a dynamic health care environment. Did it? Power in partnerships. So as the Department of Behavioral Health in our state, we are the state mental health authority. And so we have a division of the Department of Supportive Housing. I sit on that team along with our director, Maxwell Ruppersberg, and we lead our supportive housing efforts for the department in our state. And these are team members. We have a number of collaborative partnerships, of course, from the state of Georgia. We could not do anything with allocation and funding from our state legislature. We work with our state office of the Department of Community Affairs. They actually are the housing entity, the housing authority for the state of Georgia. The Department of Community Health, the Department of Corrections, the Department of Community Supervision, the Department of Human Resources, and of course our federal partners with HUD, SAMHSA, the Department of Justice, and others. So from a state perspective, we work with all of our federal partners in order to make supportive housing happen for individuals that we serve. We also have our local government stakeholders. We have 8 continuum of cares in the state of Georgia. We work with our public housing authorities and our local governments. Georgia has 159 counties. It is the second largest state with the highest number of counties. So we have a lot of coordination when you have that many counties. And we have a little bit, I would say a little over 10,000 individuals who are homeless in our state. In terms of our interagency collaboration specific to jail diversion, one of the points that we wanted to highlight was the PATH program. And PATH obviously is a national program, but in our state, we really use our PATH homeless outreach because they target those who are literally and chronically homeless on the streets. And we also are highlighting the PAD program, which stands for the Policing Alternatives and Diversion Initiative. So PATH, the goal of PATH is a formula grant, and it's to reduce or eliminate homelessness for individuals with serious mental illness or co-occurring disorders in our state. We use PATH funds to provide a menu of allowable services. In Georgia, we really focus on outreach, engagement, and making sure that individuals are connected to case management. We have 10 PATH teams throughout our state. 5 of those PATH teams are in the metro Atlanta area. That is the second largest area of concentration of homeless individuals in our state. Can I get it to go? Okay, so let me tell you a little bit about PAD. PAD fosters a new approach to community safety and wellness by engaging in creative problem solving to respond to community concerns and addressing people's human needs with dignity, patience, and care. Community referrals, partnership with the City of Atlanta's 311 non-emergency services to accept community referrals for issues of concern related to mental health, substance use, or extreme poverty. They really serve as a pre-arrest diversion referrals for law enforcement to provide immediate alternatives to arrest for individuals experiencing substance addiction, mental health concerns, or extreme poverty. We really are working specifically to not criminalize individuals who have behavioral health disorders, who are homeless on our streets. And so this is the type of collaboration that really helps with the diversion of individuals, and we help them get into the necessary treatment and services and supports to keep them connected to community-based services as well as get into supportive housing. We really have a big emphasis on community integration. We want to increase opportunities for presence and participation in the community. We know that a positive relationship between the extent to which people feel they have opportunities to participate in the community helps with their reported levels of well-being and recovery. How do we promote community integration within the Department of Behavioral Health? So we want to expedite referral processes for supported housing. When individuals are on the street and they're literally homeless, we want to reduce those barriers that keep individuals extended on the street. We want to make sure that we are working collaboratively to place people as quick as possible. We want to ensure that local communities know how to access their safety net provider. At the Department of Behavioral Health, we are considered the safety net provider because we fund agencies and providers to make sure they provide core community services, mental health, behavioral services to individuals who are homeless, uninsured, and underinsured. And we want to decrease recidivism of who we call our high utilizers with significant behavioral health needs in our state. We know that individuals who do not have a behavioral health home, they are frequently going to the emergency room instead of going to their community provider. They're frequently being coming into contact with law enforcement officials when they should be getting treatment and services. So we really have a very strategic program where we try to identify who we call high utilizers of these services and make sure that we put navigation in place to provide those necessary supports. Trying to get this to move. So the Office of Supportive Housing, specifically the area in which I work, the department has a continuum of housing and residential support services. And so what do I mean by that? We have residential supports because we are dealing with individuals who have chronic, severe, and persistent mental illnesses. And so not everyone will be immediately ready to go into an independent living situation. So really, this shows our current reality where we have current living situations of individuals who are living on the streets, who are literally homeless, people who are in our crisis centers, people who are in the correctional facilities, people who are coming out of the community outpatient services, and we want to connect them to our providers. So we have an array of residential programs. We have crisis respite, which is short-term respite stay for individuals to divert them from criminal justice. We have semi-independent residential programs, which also offer a level of support and services and help them with that skill building. And we also have group home type settings for those individuals who need a very comprehensive, intense level of oversight. And we also have independent housing. And when we look at independent housing, we're looking at those supported housing programs that were mentioned earlier. We also use the HUD programs. We also use the rapid rehousing programs. So we really look at it as a continuum of care. There is not a one size that fits all. We really take a personalized, centered approach to how we actually work with individuals on the street to make sure that they're connected to these wraparound services. And we do embrace a housing first model. And as we do that, we really talk a lot about informed choice and making sure that we are linking individuals to the most appropriate housing option to meet their clinical need. That's very important in all aspects of placement in the work that we do. What is permanent supportive housing? We really want to make sure that the housing is affordable for the individual with flexible community-based services. And ultimately, that is the permanent supportive housing that we're trying to create in our state. So specifically, the Office of Supportive Housing, we want to house, support, and sustain eligible individuals in need who have severe and persistent mental illness in order to prevent homelessness and promote independence and long-term recovery in collaboration with our network of partners efficiently and effectively. Our signature program that we have in the state of Georgia is the Georgia Housing Voucher Program, commonly known as the GHV and Bridge Fund. So this is a rental subsidy that individuals who are chronically homeless, who have chronic histories of involvement with criminal justice, chronic histories of being a high utilizer of crisis services, frequently readmitted to our emergency rooms, they actually have access to this Georgia housing voucher. One of the things that is really specific about our GHBP program is that it does not exclude sex offenders if they actually need housing and they have a diagnosed clinical severe persistent mental illness. So we are one of the few programs that provide a rental subsidy to individuals who have a sexual offense background. Many of the HUD programs that we speak of, I think you are aware that that is a mandatory exclusion. But for this particular program, for us in Georgia, the focus is getting individuals who have the severe and persistent mental illness, who have chronic histories, in a place of community integration where they have supports and services so they do not have to go back into institutional placement. So that's very important for us. That's very unique for this program. We also have bridge funding. Bridge funding is transitional support for one-time move-in assistance. So as we are working with individuals who are literally homeless on the street, we actually provide up to $2,500 to help them move into that housing unit. So those things cover move-in expenses, utility costs, application costs, furnishings, things of that nature. Each participant in our program has access to this bridge funding. Based on our active authorizations, meaning these are individuals who are actively engaged in our Georgia Housing Voucher Program. At the time that this slide was created, we had about 1,700 individuals who are actively in the program. Since this slide was created, I can tell you that number has gone up to about 1,900 people that we're actively serving in Georgia with a rental subsidy who have a severe and persistent mental illness. And this is significant because we are the Georgia Department of Behavioral Health. And again, we are the Behavioral Health Authority, but we operate a very large rental assistance program. So in our state, this is a picture of our state map, and the majority of the individuals who are on our Georgia Housing Voucher Program are located in our metro Atlanta area. So that's that green area there. And then you can see how the other participants are dispersed throughout the state. It's not a surprise that the majority of our Georgia housing participants are located in that green area that you see, because that is where our metro area is. And so that is where the concentration of homeless individuals with the highest need, that's where those funding subsidies are going. For our voucher program, 70% of the participants in the program are African American, with about 23 to 24% being white, Caucasian, and then you see the remaining breakdowns there. We're about half and half with our male-female gender ratio, and then you can see the distribution of our participant ages that are in the program listed below there. In our state, we actually have a tool that we call the Supported Housing Need and Choice Survey. And this is significant because it provides a standardized mechanism for behavioral health providers to determine need and access to supported housing through the Department of Behavioral Health. So our NSH, as it's called, need for supported housing, is not connected to the continuum of cares, is not connected to the homeless system. This is a mechanism that we use for our behavioral health system to determine those individuals who have those diagnoses, who have chronic histories, and who need access to supported housing. And this is the unified way that all of our mental health providers, if they want to make referrals, they actually go through this unified process and complete the supported housing needs survey. That is statewide, and it's been implemented since about 2015. Community and housing coordination. We must make sure that we work in the community to build and sustain relationships with our community providers. We coordinate the planning and the implementation of the handoff of the individual's case to partners in the community, and we assist with ongoing case management with high-need cases. So we divide our supportive housing process up in phases at a very high level. Our first phase typically is outreach, and then we move into assessment, and then we move into application. And so outreach, assessment, application, and you can see the points and highlights under each one of those areas that we look at as we start the engagement process. Once we get finished with the application, then hopefully we're moving into our housing search process, our leasing phase, And then our long-term phase is considered stability and ongoing supports. So at a very high level, we put our supportive housing process in a 6-phase tier. And when individuals are being supported, there's somewhere along that continuum within our phases that I just described. So for our PATH program and typically how we do outreach and case management, it's very similar to probably what you've heard previously. We obviously work with outreach of individuals. We do the screening, we do enrollment, we do emergency placement, we do case management. Case management is fundamental. It is a primary activity of the services that we offer to individuals who are accessing supportive housing through our community-based providers. And ultimately, the goal is to get individuals linked to a permanent supportive housing placement. We have in Georgia a housing supports program. So we know that individuals with chronic histories, they need support to maintain housing. What's very unique about this housing support service, it's not a clinical-based service. It is more of wellness safety checks to make sure that individuals who are located in their permanent supportive housing locations, that they have the ongoing necessary supports to maintain community integration and not become homeless again. So if you're involved and you're enrolled in our housing support programs, you can see there the key things that we're going to work on to make sure that you maintain your housing, make sure that you're compliant with your lease, make sure that we are talking with your landlord on your behalf to make sure that if there are any issues or barriers with your compliance with your lease agreement, we want to make sure that we intervene as soon as possible. So this housing support service is something that we're mandating for all of our participants. Again, not a clinical service, but an agreement that you will let us come in and make sure that we're checking on you for your safety and your wellness while you're living in the community so that we can maintain your community integration. So very successful, and we're looking forward to more success as housing supports is deployed statewide. As we are the Behavioral Health Authority, we have an array of adult community mental health services that are available in our state. I'm not going to go through the list, but you can see all the array of services that we have under the Department of Behavioral Health. And all of our participants, all of the individuals that we come in contact with, especially as you're trying to work with individuals to divert them from criminal justice, they need access to comprehensive mental health services and supports, and we have an array of that in our state. We also have, we have to talk about how do we pay for these services and supports. So this is a list of our Georgia's Medicaid services that we can wrap around the individual who have chronic mental illness to make sure, again, that they have what they need to maintain their housing so they're not coming in contact with criminal justice and institutional placement such as recidivism in psychiatric hospitals or crisis centers. So we have a plethora of Medicaid services that we wrap around individuals. And when I said that the Georgia Department of Behavioral Health is the safety net for individuals who do not have Medicaid, that is where state dollars come in. And that is where we have what we call our safety net providers. Those are community-based providers that provide comprehensive mental health services for individuals who are uninsured. So those are how we kind of multi-layer and blend our funding to make sure that we cover every aspect of a person's need. We have housing transition services, and I know we're coming close to time, so I'm going to just at a very high level, housing transition services provide direct support to individuals with disabilities, and housing transitions and supporting interventions is actually something that all of our providers pay special attention to this area because we want successful transitions and making sure that individuals have a comprehensive access to services, and making sure as well that the ball is not dropped and that individuals are not lost in some of the bureaucracy that happens when you're trying to get them placed. So we do all of these things that you see listed to make sure that transitions happen successfully. Peer support, I'm not sure if you knew this, but Georgia is the first state in the U.S. to bill Medicaid for whole health peer support. We have a comprehensive certified peer support specialist program. This is really important when it comes to diversion because we have a number of certified peers, individuals with lived experience, individuals who have been incarcerated previously, who have a diagnosis of either behavioral health disorders or substance use disorders. We actually certify those individuals and we actually give them employment opportunities so that they can actually work with other individuals and help them navigate the process from homelessness to housed. So we do have our peer support and wellness centers that are very important in our state. We have forensic peer mentor initiatives. These are certified peers that actually go into the Department of Corrections in our state, and they help individuals transitioning back into the community for reentry. And I mentioned about our certified peer training, which is about 100 hours of peer training, and they actually get a certification. And our community providers can hire peer support, and they can actually bill Medicaid for the services that they provide. So we're very proud of the peer support services that we offer, and how that really works to divert individuals by providing that engagement so they are not touched by criminal justice. And that was really, really fast. I know we were short for time. Again, my name is Leticia Robinson. Thank you for allowing me to present, and hopefully we can go a little deeper when we have our discussion session.
Thank you, Leticia. So we will shortly move into the discussion group portion of today's event and have some time to address questions from our participants. If you have not already, oops, going the wrong way. Okay. So if you've not already, please type any questions into the Q&A pod at the right, and we'll answer as many as time permits. Again, I want to remind you that there is a webinar attendance certificate if you're interested in downloading this for personal use. Again, it's not for CEs, but it can be for personal use. You should see a file transfer box pop up on your screen. Under file name, click the files you would like to download. It should turn, and Sam, I'm not seeing a file name. There we go. Okay, so if you want to hover over the file name, it should turn blue, and then download button should turn a darker gray. So when you click on the file, you can click on the download button, and it should initiate the process to download the certificate directly to your computer so you can have it in real time. If you don't see the file transfer box, or if you have any difficulty getting the certificate, you can email Sam Rogers at PRA, and his email is srogers, ROGERS, at PRAINC.com. That's srogers at PRAINC.com, and he can assist in getting you a copy of this certificate. So if you haven't already signed up for the Gains listserv, then I encourage you to sign up. There's a link on the screen that you can copy and put into your web browser, and it'll take you to a place where you can enter your information, and it'll make sure you stay up to date with all the Gains Center activities. We'd like you to also know that a housing fact sheet was developed as a resource for this webinar, and it will be sent to each of you that have been participating today. But we also want to make sure you sign up for the listserv, because that will be another way for you to access that resource. And again, we want to thank you for your participation in today's event. And if you have any questions or comments, the Gaines Center's direct comment is here on this website. And you can go to samhsa.gov/Gaines-Center, or there's the phone number to directly reach us. If you'd like to stick around for the discussion group on today's webinar, we encourage you to do so. So now we will transition to our discussion group, and we do have many good questions that have come through. We may not be able to get to every question because there was lots of good interest in this webinar, in this topic, and so we're going to do the best we can. We will also make sure you can get contact to the presenters so you could reach out to them directly if you have questions we weren't able to get to. For this discussion group, we're pleased to be joined by both our presenters, as well as 2 additional colleagues from Georgia. We've got Patrick Jones, who serves as the PATH lead at Community Friendship, Inc., and PATH lead for Georgia's Region 3 PATH teams located in Atlanta, Georgia. And we also have Moki Macias, who serves as the Executive Director of the Atlanta-based Policing Alternatives and Diversion Initiative, known as PAD, since it was launched in 2017. So with that, I am going to start with the first question, and they came in so many different orders. So if I recognize one question for Julia or Leticia, I'll direct it, but I may just put a question out and one of you may start and the other could certainly add. So one of the questions that came in, and actually, Julia, this will kind of focus on you initially. So how do individuals feel about living across from the jail? Do they want to be further away from it, or have there been any issues about the facility that's across the street from the jail? You're on mute.
Sorry. That was such a good question because some people don't like it. What we've done to counter that is we actually have moved people's rooms so they don't have a view of the jail. Other things that we've done, for example, we do biometrics. So you actually, put your finger down. It's a finger image, and it helps us collect data on services and all of that. We make sure that people know that it's not a fingerprinting. We work really hard for people to understand that we're a safe space. We work really hard, with our law enforcement, that if they have a question for someone, they come in the building, they see security, you're not going to have someone like a sheriff's officer approach you or ask you questions or say anything. So we've had to work really hard because there's definitely trauma that has occurred that we have to work with people. So that is certainly a downside, but we do our best to address people's concern around it. And just one last thing about that too. We also work really hard to make sure that people can't come in looking for people. So if you come in to the shelter, looking for someone, we make sure that we never give that information out. We try to be as protective as possible for our folks to make them also feel safe.
Great, thank you. This will actually be for both of you, based on both of you talked about sort of the continuum of some different housing models. So we know shelter is still a model that does get used, but to expand this from shelters and some transitional. So what do you do about pets? And particularly many of our veterans have, whether it's a service animal or just comfort, emotional support, but many people that are homeless that you're trying to get into housing may have pets. So how do you handle pets?
Leticia, do you want me to go first?
Yeah, you can. Yes, go ahead.
Okay. So what we do is I've written a policy. I did a lot of research around the policy, and certainly if someone has a service animal, they are allowed to come into shelter with that service animal. The animal just has to be up to date on its shots. because quite honestly, a service animal is going to be a very well-behaved animal. They're well-trained, so that's never an issue. Emotional support animals are a challenge. That has not been something we've been able to successfully do within shelter, but during the pandemic, we've had people who are in cars with their animals, and we have found motels that will accept animals. So that was like a really important part of getting people out of their cars. There is an occasional situation where we've had more than 3 animals. Motel usually has a problem with a volume of animals. And in those cases, we help that person either find someone in the community that will take like one of those animals. And what I'll do is kind of like a diversion tactic, which is I'll give money to that person to cover the cost of feeding the animal or caring for the animal, trying to alleviate some of the cost that's incurred there. So, and then also we're trying to find housing for that person that accepts pets too. So we go to certain landlords that will allow people to live with pets, because we have people that will absolutely choose to stay outside if they cannot be with their animals. And so it's just not something that you have to take that into consideration and build your policies around that. Leticia, I'll turn it over to you.
Yes, and I'll say now for the State Behavioral Health Authority, of course, we're not directly operating facilities, services, and shelters. So I will say for our permanent supportive housing programs like the Georgia Voucher program, what we're doing is if we have individuals who have pets, we are asking for reasonable accommodation through the landlord, and sometimes we will get the advocacy center in our city to help those individuals process that request. So that's how we've handled that when the individual wants to go into a rental unit and they have a support animal. And so that's how we've done that, especially under the ADA criteria. So that's the reasonable accommodation request. Now, I'm going to ask my colleague Patrick, who works in homeless outreach in our Atlanta continuum of care, if he could respond to in terms of his experience with working with individuals who have pets trying to get into those shelters. Patrick, are you on?
Yes, I am.
Yes.
And as you stated before, dealing with hotels and dealing with other private owned properties, we've had success with working with individuals with pets. And sometimes, as it stated before, depending on the shelter, there may be limited access, but we try to find alternatives such as friendly hotels and privately owned apartments.
Thank you so much. Great. As we know, many people with serious mental illnesses do not always volunteer for treatment or for services by virtue of their illness, oftentimes making that very difficult. So how do you sort of engage somebody that is not really in a sort of volunteer position to encourage or to engage them? So what happens to people that are homeless with serious mental illnesses that are not really volunteering to participate?
Leticia,
I'm going to ask Patrick because he has a lot of experience with that, working in that homeless outreach.
Okay, you can answer first and then I'll follow. That's fine.
Okay.
Change it up. Sure.
So one thing that I've learned is interviewing is 2 ways. It's not just one way. It's both directions, and gaining trust is our #1 asset when doing outreach. And based on my experience and based on different types of skill sets such as motivational interviewing, we try to meet individuals where they are, eyeball to eyeball. If we have to bend down on one knee to meet them at eyeball level, we do all we can to create a space of respect and a space of understanding where individuals feel more comfortable with sharing. And again, we realize that they're also looking and interviewing us at the same time. So we have a sense of understanding what traumas they may have been through, and we just try to listen more and then try to give them an opportunity to tell us what they need help with versus what we think they need help with as a gateway into other services.
Right, right. I'm going to say something a little controversial, and this is my 30 plus years talking. You have to be okay to let people fail. And I think that's the biggest thing here is we try to, it's really hard that you can have someone and see that they're going to need all these services and they don't want them. We have allowed for people with serious mental illness who have flat out refused case management to pursue a Section 8 apartment without support systems. And what we do is we kind of let them go through the process. They'll find it increasingly challenging to go through that process without assistance. And maybe they'll say, okay, I don't want case management, but I want help like housing search. I want that. So we'll attach housing search, right? And they start to develop a relationship with people. Or if we get them into the housing and then they start needing help with something. It is a very challenged. Now, this is not something we do predominantly, but for those outlying cases, for people who will continue to choose to live in a car, to live outside, because they absolutely refuse to acknowledge their mental illness or accept any kinds of case management, we have done these kinds of interventions. And, you can white knuckle it sometimes. It's scary to do it that way, but you need to remember about what our goal here is. We're discussing ending homelessness. And for some people, that means we're not going to be able to fix them, especially not initially. It's about the intervention and the application and the stability of permanent housing, and then working from there. And by giving the person the thing they want, by letting them set the agenda, you're going to go a lot further in being able to do that kind of intervention. But yes, it's a bold way to work. And, it's not for the faint of heart, but I have to tell you that it's necessary for a certain population and segment of this group. It's going to be absolutely necessary to do a true housing first intervention.
Thank you. So, is there any collaboration being done with HUD to reduce the documentation required for housing choice vouchers? I think, okay, go on, Juliet.
I mean, I can absolutely tell you, yes. What I find is that HUD is consistently making that easier, especially right now. We have COVID, people can't get IDs. That's a big thing right now. People are really struggling. My experience is really not on the HUD side or my housing authority side. It's been on the provider side. It's been on the social services side. So I'm always talking to my community like, listen, we want verification of disability and all of these kinds of things. And I'm like, well, they have an SSI and can we use that? And how about if this is pending, but we just connect them to the housing and get away from the restrictions around documents. So I think there's for everybody to look at the reality. I think HUD is fully aware of the reality of where we all are right now, where people are in motels. We don't want them to go back to the street. We want to get them into housing and eliminate a lot of this, especially if you look at like ESG right now. ESG has very little requirements to get assistance, much less than a lot of provider agencies, to make that easier. And, for us here in New Jersey, there's not that same sustainability thing you have to see, right, to get this rapid rehousing. We're basically looking to get as many people into housing as we possibly can.
Hi, and this is Leticia. Just to piggyback off of that. Now, in our state, initially when the pandemic hit, there were some modifications that were made to our housing choice voucher process. But as it is currently, our providers are still, submitting the full application with the full requirements. So anything that was waived initially hasn't been waived now. So they're back to business as normal, and we've been having to submit all documentation, as required. So I don't know if that may be different from state to state, but we haven't seen an alleviation of the required documents. Now, I definitely know that, because we've said that in different opportunities we've had to give feedback to HUD and whatnot, that we constantly hear about the cumbersome paperwork that has to be turned in. Housing choice voucher is not a quick process. So if you're looking for emergency housing, that's not going to be the way that you need to go. It is the vehicle for long-term housing. And I think that for providers, we need to keep that in mind. I'm constantly talking with providers you have to understand the buckets of housing that you're dealing with. And if this is a long-term option, that's not going to provide housing today. So I think also educating providers and understanding what the different programs are and what the requirements are and what is the initial purpose versus long-term transitional emergency. I think that's important and key as well for our providers who are doing these applications for individuals.
Great, thank you so much. So this was I think a very worthwhile question. Oftentimes when we're talking housing, of course, and shelter, we're talking about our adult population, but we do know there's older adolescents that are homeless. They may not be connected to a family and such. So are the continuum of care just for adults? And if not, how does this work for anybody that may be under the age of 18 and homeless?
Leticia, you want to start?
Well, I'll say this, y'all. Yes.
Go ahead.
I'll say this, in the continuum of cares, when I've been involved, we definitely have an array of subpopulations that we work with. And it really is dependent on that community and what that community deems as priority for their continuum of care agencies. Because we do have, and I've been a part of applications where we've worked with transitional housing programs, and we've served the young adult population. Now, I have not worked specifically in programs where there have been a continuum of care program for individuals less than the age of 18. Now, that might be something that is happening in other communities and continuums of care I have been involved in. 18 was at least, and the young adult population typically would fall between 18 to 24 in terms of the subpopulations that we work with in what we would call the youth category. So that's been my experience with that. And Julia, I don't know, have you guys worked with less than 18-year-olds in your continuums?
Yeah, I'm also looking at all the questions, and I hope everybody knows, if you still have a question for me and we're done, you can certainly reach out, because there's so many good questions. So actually what I did is, when we ended chronic homelessness and we ended veteran homelessness, I was like, okay, what's next? What are we going to work on next? So it was young adult homelessness. So I actually chair the task force for young adult homelessness and brought in all the partner agencies to really focus on 18 to 24-year-olds within our community, because they're very unique. Their needs are very different. They don't do well in our shelter. A lot of times they may be preyed upon by older adults. There's just no services for them in the same way that they would have in a young adult shelter. So I think it's really important for our young adults to number one, also get training. Like, I got a whole bunch of training, and I had to stop adulting. I had to learn what that meant and what that was, and, setting the agenda, because I have kids the same age. So I'm kind of like, oh, okay, bringing in young adults into the process. So I actually have a young adult who's on this committee with us with lived experience, which is really, really important when you're going to do this work. So what we have done in our COC list is we have added people who are 17 and a half to the list. We want to know when they are approaching 18. We want to be able to intervene, right at the cutoff when we can do that. And if they need shelter, we do have, youth shelters and transitional housing like Leticia talked about, but we're looking at them in our adult system. before they're even there, to try to anticipate any particular needs and plan for them before they turn 18.
Because I would say that individuals, if they're homeless and they're under the age of 18, typically that would fall, I would think, in the auspices of your Family and Human Services division to really intervene, not necessarily in the continuums of care. So, like I was saying, and I'm glad to hear the 17 and a half, because they will turn 18. And then I totally agree that that is a specialized population that needs specific services and supports, because they get preyed upon when they're in the traditional homeless environments. So I totally agree with that. But to answer the question, anyone that's under the age of 18 typically would be in the family and children service arena, and should be getting their supports there. And, and so, yeah.
Correct.
Thank you so much. So I know, Julia, you had spoken about the sort of one-stop shop. How might rural communities develop a one-stop shop? Because they're not as concentrated as a more urban area. So what might be some ideas for rural communities to sort of coordinate the efforts?
That's a really good question. And I think it would depend upon the specifics of that community, because I think that there's no one size fits all. Like, so my facility, there are elements of it that will work certain places, and there are elements of it that will not. And so I think what's most important is, if you're going to develop a service, especially in a rural environment, is, are people going to use it? Is it meeting things that they need? Can they get to it? I mean, that's a big piece of it, right? Would be transportation. If it's centrally located, like, where is it located? How are people going to get there? I think I've had a lot of communities in my private practice come to me and have conversations about, we want to do what you did, but we want to put it on the outskirts. We want to put it away from the downtown. We want to put, like, everyone's idea is we want it away from things. So when you're looking at design, or you're looking at how are you going to meet the needs, you have to have a really good understanding of what those needs are and how you connect people. So it may not be the best idea to put a facility there that people can't get into, or it's not meeting their needs. So I think that rural communities really have to be creative and responsive by using people with lived experience in that community in terms of what would help them, what would work for them. I think so many of us think we know everything, and we don't ask the people who are experiencing that, because if they're the ones who are going to use it, it has to serve their needs. I mean, that's just my very general response.
So I'm going to expand that a little bit for Leticia, because I know, Georgia, you're coming from the statewide, and there are many rural communities in Georgia. So for those that work in rural communities, in terms of even not so much a one-stop, but just the sort of accessing housing resources or building collaborative relationships. So in rural communities, people that are homeless can get into housing.
Yes, so we have in our PATH homeless outreach program that we have, so we definitely have those homeless services targeted into rural areas. Also, for the Department of Behavioral Health, we have what we call a community support team, and that was a service specific to Georgia in our array of community behavioral health services, specifically for rural communities. And so if we have a community support team, they actually go out, and it's a 3-person team, typically a peer, a case manager, and a licensed clinician. And they go out specifically in the rural areas, and they actually work with individuals who have primary health disorders, co-occurring disorders, who are literally homeless on the street, to access services and supportive housing. So those are just a couple of the initiatives that we've tried in order to reach the rural population. It is much diverse. And even within the rural population, there are still differences. One of the things that we do from a state level is that we are divided into regional offices. And so in the more rural regional areas, they have what we call community collaborative meetings. And so that is an opportunity for us to take the lead and bring all stakeholders together in that rural area to talk about the priorities. And as behavioral health, mental health, criminal justice is on that list, you have everyone there and they actually come up with a plan of action. So it definitely takes stakeholder involvement. It takes getting all the players to the table and coming up with a comprehensive plan and really maximizing resources that's already in the community. We already know that we need more, but in this current environment, there's not always the opportunity for more. There is an opportunity to maximize what you already have. Now, we have had a lot of success with the COVID funding. I'm sure many states have gotten COVID funding, so that has also helped us to put some funding in some rural areas to fill some gaps. So that's been very, very beneficial. So from a state perspective and your local county governments, I would say get involved with those officials, find out even how you can use some of this new funding to try to address these critical issues of homelessness and housing. So that's what I would say.
Great, thank you. So do you feel the HUD's definition of chronic homeless is a barrier to getting people housed?
Why did I have a feeling you were going to ask that question?
Mental telepathy.
You know, that's a I've been responding to some of these and I was like, ooh, that's a tougher one. I can tell you that while we were ending chronic homelessness, the definition changed, I believe, 2 to 3 times. And every time it changed, it affected who was included and who was not. For us, initially, it opened up during the time that we were doing this. I think it's really important to also see that for my community, we no longer have chronically homeless. So what we have to do is we have to prove every time we place someone that there's no one on our list that's chronically homeless anymore by that definition, so that we can place them in housing that's specifically for and prioritized for chronically homeless people. I think that communities have to really use their resources. Like we use police to verify people sleeping in automobiles. We have to, it's not a very easy thing to do because you have multiple ways in which you have to prove duration and length. Also what happens when people go into the hospital, right, or they're incarcerated, and if that changes it. So it can absolutely be very challenging for some communities where they have thousands and thousands of people. I think there's less of that impact, but in communities where they have less people, it can feel like you're losing the ability to help people who really, really need that. Leticia, I don't know if you want to add.
I'm going to ask Patrick from his perspective on the chronic homeless definition and working with the continuum, what his perspective or answer or response would be.
Yes, as Julia said, that is correct. It has changed from time to time, the definition. And thankfully, we use a tool here in Georgia called the SPDAT.
Mm-hmm.
And it's a series of questions that we ask individuals, and it has a score at the end. And based on the higher the score, it points to more chronic than a lower score. And a lower score, we would think about rapid rehousing or some other measure. A higher score, we would try to continue them in the continuum, whether it's going through a Georgia housing voucher or whether it's just going through our coordinated entry to find housing within our housing inventory within the city of Atlanta.
Great, thank you. So I'm going to turn this question because I go a little bit of a different direction, but such a strong part of these housing initiatives. So this has to do with the relationship and the partnership with law enforcement and PATH, or people working with the homeless populations. And And I know Leticia talked about their collaborative in the state of Georgia, and Julie has mentioned the CIT program. So I'm going to sort of shape this question in a couple different ways. So, there's a concern about the role of law enforcement in terms of possibly adding to the criminalization of homelessness when part of their responsibilities sometimes are when they do sweeps of public areas, or in terms of, sweeping away encampments, or arresting people that are homeless that may be panhandling. So one is, how might we find some alternative ways so that we are not criminalizing people that are homeless? And then maybe second to that, to speak more of how does the programs like what Leticia presented, and I know both Moki and Patrick are involved in terms of the relationship with law enforcement and PATH, to sort of take more of a lead so that other parts of law enforcement aren't sort of coming behind and, arresting or what have you. So could you talk more about, again, this sort of role with law enforcement and how it could either add to some criminalization that makes it difficult for people to maybe get housing once they have a criminal history, or being in a proactive helping get people engaged in the service system?
You want me to start?
Go ahead.
Okay. So when I came into this space, and we opened this facility, I came from a 20-year background in New York City doing supportive housing and working with Sing Sing and Bedford Hills Correctional, and my way that I think about this work was different coming in. So what I did is I started to develop a quarterly meeting with law enforcement. I went out and met with the chiefs of police. I made a deliberate effort to connect to law enforcement. And I'll tell you why, especially in regards to shelter work. Police are frustrated. Like, first and foremost, they're frustrated. If they want to be able to bring a person to a shelter and for the shelter to take them or direct them, and when that doesn't happen, I think we have an escalation of frustration. People are complaining to them. It's really understanding kind of the mindset of what their role is, what our role is. So I need for law enforcement, and I'm not going to tell you that there weren't pieces and years that it was a challenge, and different people in leadership roles wasn't a challenge. But what I do is I do a very active education. When I have a CIT class, I give every one of those officers my personal cell phone. If you're stuck at 11 o'clock at night on Christmas Eve, you have my cell, you can call me. I'm going to help you. I'm going to help you figure this out. During the entire Code Blue season in this winter, I did webinars for people because our shelter wasn't open because of the pandemic. Police didn't know what to do. And I would walk them through that. It's a concerted effort that we can't just say police have to change or don't do this or don't do that. We have to provide options and guidance and an opportunity. So if I say to the police officer, listen, don't do this in the community, but you can bring them to me, or you can bring them in, or this is what I'm going to do. Don't do that, but do this instead. I think that's a really important piece, because what we have now is a relationship where they're part of the solution with us. It's not them or us. It's us together, but I have to provide a service that's of assistance to them in getting people off the street, because I think that's really important. So I'll let Leticia, your team, answer this question as well, but it's one of the most challenging parts of this work is how do we work well together in this collaboration?
Yes, I would love Moki to take the lead on answering this.
I'm happy to, and I appreciate being a part of this conversation. So just to sort of speak to this idea of the role of law enforcement, I think We've been working in Atlanta and Fulton County over the last 4 years now, very closely with our Metro Police Department. And, first and foremost, I think that what's clear is that the police department is under incredible pressure, right? From the business community, from local residents, from elected officials to go out there and sort of make people disappear. And we have lots and lots and lots of laws that will that allow them to do that, right? So many activities over the last several decades have been criminalized, which are related to survival, right? Just the very act of relieving oneself in public, sleeping in public, trying to find food from, a dumpster, like so many activities of just basic survival are criminalized today. And then the police department is treated as the one size fits all. You go out there, you address the issue. Unfortunately, what we are all well aware of at this point is that a couple things. One, police are trained to gain compliance, and the tool that they have most often is arrest, right? And so, they are in a bit of a difficult situation, knowing over and over again that it's probably not going to actually address the real underlying issue, but it is the tool they have, right? The other issues that we see that, we are faced with an ongoing problem of police interactions with community members that go unconscionably wrong, that cause a lot of harm and a lot of, and in fact, death. And so, the prevalence of police contact with community members, particularly people who are experiencing mental health concerns, we know that there is a lot of risk associated with that. And so part of the work that we do, we do two things. We work closely with the police department to give them another tool so that when an officer in Atlanta is engaging with somebody and they know that the activity is driven by a mental health concern, problematic substance use, or extreme poverty, that the tool they have is not necessarily only locking somebody up, booking somebody in a local jail, but actually calling our team out. We offer consent-based services. It is not a requirement that somebody go with us, but we will provide people, kind of responding to their basic needs and start having that conversation about what their options could be, including emergency shelter placement. Hoteling is a strategy that we use for a respite stay as we try and navigate folks to other options. And then secondly, our strategy, which is sort of moving away from police involvement altogether, is using the 311 line. So recognizing that many of these sort of public order concerns are real concerns, right? It's not just like, oh, well, we shouldn't involve anybody. It's like, if I'm a small business owner, somebody is using the bathroom in front of my business, sleeping there, I may need help. But can we give those community members another option so that they're not involving law enforcement, so that they're not calling 911 and using the emergency services line, right? So what we're doing here in Atlanta is we're using the 311 line, which is the city non-emergency services line, something that many cities have, many communities have now. And we're telling folks, you have an issue that's related to mental health, substance use, or extreme poverty, try 311 first, and our team will come out. It's basically, it's a referral request, right? It's an outreach referral. And so our team will go out to the scene, we'll have a conversation with the individual, and we'll offer, choice-based services, right? It's not a program we put somebody into, but rather kind of a problem-solving relationship. So I think that kind of ties back to what Patrick had said earlier about really, it's a two-way interview, right? It's really respecting that person's, ability to make some choices, but offering assistance rather than simply punishing people's survival.
Great, thank you. Those are really important aspects, because I know the role of law enforcement is shifting, and needing to get folks engaged more with the service system, sort of at the first get-go is extremely important. But I think those partnerships, you have to do this with the partnerships and to support each other to be successful. So really appreciate those words of suggestions and advice. We have time just for a couple more questions. So again, I know we haven't gone to everybody's. We'll make sure you have people's contact. But let me get a couple other questions asked that I think would be of interest for the whole group. So How have your programs overcome confidentiality? This came particularly from Colorado, where they say there's a huge barrier when you have when they have multi-agency projects or to this collaboration. How do you overcome confidentiality not being a barrier to get people access to housing?
That's a really good question. When we first opened the facility and we had multiple agencies working together, this was months of negotiating, especially with your mental health agencies. They are very protective and careful about this. Where we finally landed is there's an importance that everyone has separate files. Each agency has their separate files, which are protected. But what we also do is when people come into the facility with us, they sign a release of information amongst the partner agencies that if you're going to come in and we're going to provide these services to you, you're going to agree to this now. And they can retract it at any time, and it says that on the form. But we find that we really don't have a problem with that. But once we're able to have that, so for example, some of the questions in here were like, somebody has their name on a list at this housing authority, this, we can't get that information. I can get that information. I can get that information within 5 minutes. I can get information on if the person has open benefits. All of that information that I need in real time, I can do that and triage people quickly because I have permission. So having people as part of that process when people come in is really key. The other thing is really understanding HIPAA and what you can and cannot do. Some people will say, oh, it's HIPAA protected, and people really have to understand what the purpose of HIPAA is and when it's appropriate, when it's necessary to collaborate, and in what capacities. So I think that's in my opinion, the second part of that question.
And I'll say for us in Georgia, we have a standardized housing survey that all of our behavioral health providers participate in. And when an individual wants to participate in that process, they are given because it's not required, it is absolutely an option. They have to give consent. And actually the wording is such that it says we actually can have permission to talk with anyone that is related to getting you housing. And we explain to them in that survey process that this is a multitude of agencies that may have to get information from us in order to help you find housing. Now, and so do you agree to that? So that's how we've been able to navigate that on the front end by saying, in order to get you housing, we're going to have to talk to partners and we're going to have to talk to different stakeholders and even landlords. Even if you're going out there and we have a rental assistance program, even talking to landlords on your behalf to advocate for you to get that lease, for them to accept you into the property. So we explain those kinds of things up front, and we've had success with that thus far.
Great, thank you. Thank you. So I'm going to end with this two-part question because, a key element to being successful with housing and particularly permanent housing really has to do with the relationships of the landlords or relationships with landlords. So one of the questions was, how do you go about recruiting landlords that are going to be willing to accept individuals that may have criminal background histories, serious mental illnesses, but how do you recruit and get them to want to become partners with the housing programs?
So I have to say that during the pandemic, one of the silver linings, and there have definitely been silver linings, is this, because what I found during the pandemic, once things started to open up, landlords were coming to me to say, hey, those people that get those subsidies, the Section 8, and, I'd like to give them an apartment. And these were landlords who never before reached out to me. But I realized that basically what the draw was guaranteed income. Right now, there's such an uncertainty for people in employment. A lot of people, landlords are afraid that people aren't going to be able to pay their rent. If you take a subsidy, a rapid rehousing subsidy, a permanent support, whatever it is, Section 8, shelter plus care, you're guaranteed subsidy, you're guaranteed money, and you have a person to call. So I think that we need to carpe diem right now with a lot of landlords who are looking for those guarantees. The other, pre-pandemic or just in general, I think that we work specifically with landlords who will not look at a credit score, not look at a criminal history on the very basis of the relationship they have with the case managers. So it really is the strength. And so, for example, something that we would do is, let's say someone's living in housing, there's a problem, rather than have them have an eviction, I'll put that person back in shelter and rehouse them with different kinds of supports. We'll be like, okay, that didn't work, but you don't want that eviction on their history, because once a person is evicted with a Section 8 voucher, right, they can't get that voucher again. So you don't want that. So that's a strategy that we would use, like, let's pull them out, bring them back, and then, decide how to do this differently. That's a strategy that we would use. And you preserve the relationship with the landlord because you've removed a difficult person. They didn't have to go through a court proceeding. Then you're able to kind of attach more supportive services to them, or maybe even, change a subsidy from a shelter plus care to from a Section 8 to a shelter plus care or COC voucher. So it's really about being responsive, creative, and understanding, really the same way we talked about with the police. If you understand the needs of the other partner, and you are responsive to the needs of the other partner, and you help them meet what they need, they're going to work with you a lot better in the end run. That's just always been my approach in this work.
Leticia.
Yes, I would say number one, relationship building and engagement is key. You have to get to know landlords, prospective landlords, in order for them to even consider possibly working with someone who does not look good on paper. If they just fill out an application, they don't look good on paper. For instance, we had a gentleman and he was going to get an apartment, and your prior living history. I was in Jackson State Prison for the last 10 years. So we really have to develop those relationships with landlords. I will tell you, I think it depends on the landscape of the community that you're in. We haven't had the silver lining in, I've used the Atlanta metro area. As Julia talked about, it still is very much a difficult challenge to find landlords. Guaranteed rent at one time was something that was very attractive. It is not so much anymore because of the perception of the type of individual and the problems, in air quotes, that they would have that they don't want to deal with. And if they've had history with an individual who was on our program previously, they may not be willing to take the chance. And when you're in high concentrated urban areas, that is a high demand, and affordability is another issue, because the threshold of what landlords will accept with a voucher versus what they could get at market rate, and seemingly don't have to deal, in air quotes, with those people. We've been told that. We've probably all heard that. We're still navigating those real challenges. So it's still something that we're still out there every day working towards recruiting landlords. But our experience recently is that we've had more landlords opt out of the rental subsidy program and go for regular market rate. And so it's just a constant challenge that we are continuously working on, trying to overcome and get landlords, private owners, to really accept our participants as tenants. Because I told someone the other day, you can have a rental voucher, you can have a housing choice voucher, you can have one of our state vouchers in Georgia, but if you don't have a landlord that's willing to accept it, it's just like a check you can't cash. And we've had a long history of individuals just trying to find placement. They have a voucher, but they can't find the housing. And that is something that we are constantly struggling with where we are.
Thank you. So on the flip side of that, you know, as you're able to place folks with landlords and you're guaranteeing their funding for their housing, how do you respond to landlords that may not follow through with their level of responsibility, such as handling maintenance repairs and such, so that the living environment doesn't, you know, become, you know, substandard, and that the landlord's not responding to the needs of the residents that you're ensuring they have, you know, rent for?
You know, being part of a housing authority, that's a very important piece. You know, we have inspections, we have a whole process. So certainly, you know, that the caseworker assigned, you know, that at the housing authority or who's ever giving that voucher can certainly address that, because that certainly, there are standards that the landlord has to meet, and that will absolutely be enforced. When it's not that kind of situation, what we do is, I think it's very important. One of the partner agencies we have at the center is our mental health law attorneys, and also our, we also have another group of attorneys who have a grant to work with our folks, and we'll work with fair housing. We'll get them involved. We let people know that you have the right. These are your rights. You know, that's not something case managers always know about. So the important thing is connecting them so they do know what their rights are, that they don't just not pay their rent, that there's a proper way to intervene. And that's really, again, why it's really important to have good case management, good follow-up, that people know who to go to, so they don't just find themselves in a situation where they're evicted or they get a lockout. A lot of times these become more legal issues than anything else. So they have to be properly directed whenever, if it gets to that place.
Thank you. Okay, so we just have a few minutes left, so we are gonna start wrapping this up. And again, we recognize we could not get to every question, so you know, we're gonna make sure you have the contact so you can reach out directly. I know on Leticia's last slide was her email address, so I'm gonna ask though for Julia and Leticia, would you for a moment just each give out your email addresses, and then for those that wish to reach Patrick or Moki, they can work through Leticia to get connected with Patrick and Moki. But Julia, could you give out your sort of verbalize it out to the group, your email address?
Oh, sure. I was putting it in the chat, but yes. If, you know, I think the easiest one to do is my work email, which is orlando@habcnj.org.
And repeat that one more time.
Sure. orlando@habcnj.org.
Thanks. And Leticia?
Yes, mine is my first name, Letitia, as listed there, .Robinson at D as in dog, B as in boy, H as in house, D as in dog, D as in dog, .ga.gov.
Great. And we'll get Julia's email attached to the slides. I wanted them to provide that because the slides and the recording may take a month or so before they get out. So we really want you to have more immediate access to our presenters. So in closing, I first want to extend a big thank you to both Julia Orlando and Leticia Robinson, Patrick Jones, and Moki Macias. You've been a wonderful panel today. You've given some really exceptional presentations that I think are going to be very valuable for all of our participants. And I just kind of want to sum up a couple key takeaways that I heard today. And that is the value of the partnerships is so crucial to making access to housing work. Not only partnerships, but how you work collaboratively and that strength in relationships. The political will of leadership commitment is also a very strong piece. So working with those that drive policy, funding, and leadership across all sectors is so critical. You know, really getting a good idea what your current system looks like related to housing, so you can really look at those shortfalls and barriers. So as a collaborative, you can design a system that's going to be more effective, and then everybody can start putting in their piece. You know, recruiting, but supporting landlords, again, that relationship. Knowing that having a continuum of housing models is still necessary, and helping people move from one to the other as needed. And then, of course, looking at your multiple funding strategies, both private and public, and know that not one group can do it by themselves. So again, I think it does come back down to the partnerships, the collaborative work, and the strength in relationships. So again, as we hit the 4 o'clock mark, I want to thank you again, everybody, for attending. And we hope to see you at future sessions of the Gain Center virtual learning communities on early diversion. So everybody have a great rest of your afternoon and going into a fun and safe weekend for all. Take care.